My name is Tony Epelle. I'm a chartered accountant, but I'm also on the board of the Sickle Cell Foundation Nigeria. You know that the Sickle Cell Foundation has come a long way in Nigeria, and we spent a lot of time in advocacy and management of the disorder. For several years, we've also helped to assist quite a number of patients, even to go outside Nigeria. We've got corporate sponsorship to find a cure for the disorder. Now, what has happened over time is that with science improving, there have been opportunities for a cure. So we've moved from not just advocacy and spreading awareness of the disorder, but we've gone into the management, and now we are focusing quite a bit on the cure for the disorder. This is quite novel. It certainly has been tried in Nigeria, but this center is the only permanent and major center we have in the country right now. And of course, we went into a partnership with the Lagos University Teaching Hospital. As you know, they are one of the foremost tertiary health institutions in West Africa, I must say. And we must give them accolades for what they've done to date. But what we've done is partner with them, and we've actually situated the proposed bone marrow transplant center in one of the buildings that the university hospital has made available. This is novel. This is a remarkable step in the whole area of hematology, and also in advanced medicine. This is really, we've gotten to a point of real getting into advanced medicine in this country. And we must thank Luth and indeed the Federal Ministry of Health for helping us get this far. The Sickle Cell Foundation itself set up what we would call a center of excellence. As you know, early in the day, we went into a partnership with the World Health Organization, and some of our major equipment came from the World Health Organization. And of course, that is an endorsement for a young organization. At that time, a young organization was a major step. And of course, we've sought all over the world the best in terms of the disorder. The sickle cell disorder is highest in Nigeria. But at the same time, we have not done very much in terms of developing competency. But over the years, remember that we didn't just start yesterday. We've been in for decades now, and we're 30 years now. And one of the things we've done is capacity strengthening. Remember that our core team, led by Professor Akionju, came from the hematology unit of the Lagos University Teaching Hospital, and they've always been known for excellence. Today, there's no doubt that Luth has earned its place as a major health institution, in fact, tertiary institution in West Africa. And it's a reference center, and it's also a university that people come from all over Nigeria to send their children or their wards or their parents or their loved ones to. So there must be obviously strong trust with the university, and we are aligning with them. But not only that, worldwide we've had great relationships with quite a number of institutions around the world. One of the major institutions in the world that has been involved in the sickle cell management and cure has been the Vanderbilt University, and its core team is working with us directly on this program. What else can be more than that? Because they are reputed to be number one in the world in terms of the sickle cell management and cure. So that tells you that, and guess what? The leader of the team is actually Nigerian, So Nigerians have expertise. It doesn't matter where they are in the world. I mean, and we brought this expertise home, and for several months, the staff have been going through training with the best in the world, the best in terms of nurses, doctors, and you can't have it any better. Worldwide, this is going to be not just a center of excellence, but this bone marrow center bone marrow transplant center is going to be a center of reference. It's going to be a center of reference around the world. And there's no doubt that the general public should trust in what we're doing here. The other part is, like I said, the World Health Organization started from day one partnering with us. And today, quite a number of institutions in Nigeria have the confidence to partner with us. And we need these partnerships to survive. In terms of funding of the center, we've been favored because of the stories behind what we've done. So we have state governments, we have corporate bodies, we've had individuals that are backing us up tremendously. And we must thank our founder, Professor Akinju, because of his reputation and the excellence he has shown. Donors have come our way, sponsors have come our way. And the same thing with our current chairman, Chief Afolabi. It's a wonderful team that we have running the center. So we must thank Chevron, NNPC and Chevron. We must thank the Lagos State government. We must thank all the donors that have come to our aid. But in particular, it's important to know that it's not just, it's just the foundation. When you have the foundation of the house, the house is not complete, it's just the foundation. So we need a lot more support. We need a lot more partnerships. I mean, that's the way this is going to grow, because it's going to cost a lot of money to keep it sustainable. So we're going to appeal to the public, appeal to corporate sponsors, appeal to individuals, and those who understand what this, what the management and cure of this disorder means. We're going to appeal to you and encourage you to please support this project. In my younger days, we used to have fears about the disorder, the sickle cell disorder, in my younger days. But since then, things have changed significantly. And in particular, the Sickle Cell Foundation of Nigeria has helped with this change. Because of organizations like ours, and of course we are probably the foremost non-governmental organization that is focused on the sickle cell disorder. I think we even do more work than even many government agencies. So we've created awareness of the fact that you can live a pain-free life. We've created awareness that there are certain things you can put in place to ensure proper management of the disorder. Certain things you need to put in place. So I want to say very clearly that there is a lot of hope now, even though it involves quite a number of things we must do upfront, but importantly, we must understand there is enough management of the disorder to enable everyone that is a patient, a sickle cell, that has the sickle cell disorder in one way or the other, to live a healthy and long life. A healthy and long life. So today, very clearly, a lot of sickle cell patients are in their 60s, their 70s, you know, and even I think we have a patient that is in her 80s. So there's no fear that parents should have, because once they keep to the regime that is prescribed, they will live healthy and long lives. The other part of it is that science has moved on, and there is actually a cure, especially a cure through bone marrow transplantation. So we want to encourage parents never ever to lose hope. There is the management and there is the cure of the disorder. More information, of course, can be gotten from the Sickle Cell Foundation Nigeria, and of course at its bone marrow transplant center situated at the Lagos University Teaching Hospital.